And ladies and gentlemen, now we would be talking about the opportunities in healthcare in our next session. It will be all about artificial intelligence in healthcare using tech to enhance brain performance, making health infrastructure cost effective, and trends in insurance sector. So ladies and gentlemen, to start the session, I would like to invite our panelists. And the session name is Opportunities in Healthcare. The speakers of the session are Mr. Joy Chakrabarti, COO, PD Hinduja Hospital; Mr. Sanjay Datta, Chief Underwriting, Reinsurance Claims and Actuarial, ICICI Lombard; Mr. Prashant Warrior, co-founder and CEO, Cure.ai. And ladies and gentlemen, this session will be moderated by Mr. Kumar Bagrodia, founder, Neuroli. So I would just like to give you a quick bio of Mr. Bagrodia. Mr. Kumar Bagrodia is the founder of Neuroli, India's leading applied neuroscience company, leveraging brain-computer interface technology for better mental health and brain enhancement. Often called India's brain enhancer, Mr. Kumar holds an MBA degree from the University of Oxford, is a country champion and ambassador for the Oxford Business Alumni in India. Ladies and gentlemen, he is a member of the National Startup Council of CII and is a member of Apex Council of the India Innovation Initiative by the Government of India. He has been featured in various media in India and abroad, including Knowledge at Wharton Wall Street Journal, India Today, The Economic Times, Hindustan Times, Bloomberg TV, TV Times Now, CNN News 18, CNBC, Avas, Fortune, and Forbes, to name a few, and is a speaker to a leading podiums. Ladies and gentlemen, it's going to be a wonderful session. So now I would request Mr. Kumar Bagrodia to conduct the session. Over to you, sir.
Thank you. Thank you for a very long and detailed introduction. Welcome to all the panelists, Mr. Chakrabarti, Mr. Datta, Mr. Warrior. Let me start with a very brief introduction for each one. Mr. Joy Chakrabarti is the Chief Operating Officer for the PD Hinduja Hospital, and he has over 21 years of experience in the healthcare industry. He is on several industry bodies, including CII, and speaks on various fora in India and abroad, and brings with him tremendous expertise and experience in overall management of healthcare systems. Mr. Sanjay Datta is the Chief for Underwriting, Reinsurance and Claims at ICICI Lombard General Insurance. He was part of the startup team at ICICI Lombard in 2001 and has since then contributed to growing the business into a market leadership position. Mr. Prashant Warrior, he's the co-founder and CEO of Cure.ai, which is a company that develops AI solutions for radiology interpretation, which are now deployed in more than 28 countries. In 2016, he was named one of the top 10 data scientists in India. Thank you, gentlemen, all of you, for joining. And this is going to be a great session titled Opportunities in Healthcare. Given my background where, we are trying to address mental health or brain-related issues without using any medicine, whether allopathy or whether Ayush, just using data. The context I would say is that the opportunity in healthcare perhaps is not only about better medicine or different kinds of medicine, but how can we use technology and data to our advantage, both at the care provider end as well as at the patient or the individual. So whether it is at a preventive level, people are trying to understand their own biology better, or at a care provider's level on how we can use technology to leverage data to help people. So given that context, and given that all three of you are obviously approaching this from very different fields, one is insurance, using AI and using, healthcare delivery, I would open up to each one of you, starting with you, Mr. Chakrabarti. where do you think are the key opportunities going forward, given the context of healthcare not just being restricted to medicine alone?
Good afternoon, and thank you, Mr. Bagrodia, and thanks IMC for inviting me in this today's session. So, as I have understood the question what has been asked to me in terms of technology and where we are heading to. So, over a period of last 10, 12 years, Indian healthcare has grown in a good pace. Year to year between 2008 to 20, it was going with a pace of 16% year on year growth. And we have seen several in terms of parameters how healthcare has grown, whether it is in terms of total business value, which has gone to an extent of 280 billion US dollar in 2020, expected to grow at 372 billion dollar in 2023. In terms of job opportunities, so many direct employment, indirect employment, and all these have happened. And probably the time has come when we should concentrate and we should see that how, instead of working on a brick and mortar model, creating more and more hospitals, how we can adopt this technology and how we can take it forward. To give you some example, I want to tell what we have learned out of this COVID pandemic time. And all of us, when we are sitting, many of us, when we are sitting at home and we are looking for healthcare solution from our doctors, the most promising one which came out was the telemedicine teleconsultations. Fortunately, it has taken a major leap, and today even I can see that many of the doctors and patients are quite interested and familiar with this mode, and they are looking for this solution as a permanent solution for them. And what was not very prominent and clear before the COVID scenario. And I want to share one data with you, data point. There were 800 physicians who were contacted by a consulting group, and their feedbacks were obtained that what do you feel about this sudden emergence of this teleconsultation and telemedicine. And I'm very happy to say that 85% of them have told that they are comfortable and they want to continue with the similar kind of facilities. 50% of them, 50% of them, they felt this digital platform is something good and they are comfortable with that. 80% of them, they have told that this is a solution which needs to be followed in future too. And most importantly, 44% of this teleconsultation which were done, the consumer or the patients on the other side, they are also comfortable. So there was a study. So that shows this is the way in future, that how do you expand your reach. The
Right.
other thing I want to talk about in terms of technology solution is home care. Today, by virtue of having so much of artificial intelligence and other technology solution, and I'm sure Prashant and all are going to talk about those, I'm not getting into the details. All those home care services which are not thought about, all those have been made very easily available. So considering the time, I want to focus on these two areas, and I want to tell, I'll not get into insurance and all, but I want to tell that these are probably the two top picks of technology front of it, which I can share has taken a major momentum and is going to take our healthcare towards these two areas, and most of the populations are going to get coverage out of this. So over to you.
Some very valid points, Mr. Chakrabarti. Clearly, for a country like India, with the kind of geographic reach and the problems that rural India presents in terms of healthcare delivery, clearly technology and telemedicine, and as you mentioned, care at home can be viable models to ensure that we are able to provide service and care in every nook and corner of the country. I'll come to Mr. Datta. As a head of underwriting, clearly, data is of paramount importance. And what opportunities are you seeing both from the insurance side and in general overall of data playing a role in healthcare?
You are spot on. You can hear me?
Yes, absolutely.
Data is going to be the crucial kind of, underlying, platform in terms of, how it will, work together on the healthcare, insurance, and various other spaces which work together. And I think towards this, a lot of work has been started at the government, and I must applaud them in terms of work happening, in terms of MDHM and various other government bodies to get the data platform together. And so a lot of work is happening around that. Having said that, I think the most important thing which what we learned out of this entire thing is that data is important to everybody, not only to the provider, the space in terms of what it means to treat. You need data to treat and all of that. The patient history or the ongoing treatment. It's very, very important for us to be able to understand risk, the health risk, very, very strongly. And finally, to the patient needs to be the owner of its own health data, because that is something which will be required at every stage of his being able to monitor his own health, and being able to offer that data to others to be able to take a view around his risk, or what treatment needs to be taken. All this is thing. And I think the good part is that the way I think a platform has been developed for vaccine is a good way to start, where everybody is able to, the person himself, the government and various other ecosystem players can latch on to that platform and be able to check on whether he's vaccinated or on what kind of vaccine, various things like that. It's just a harbinger of things which is possible, and where we are able to collate a lot of stuff into the kind of a stream where we are able to all use it. But just to focus on insurance, why it is very, very important. I keep saying that insurance is about managing your health risk in terms of the financial implications of your health risk, in terms of getting treatment and not. So there are various segments of it. Of course, we want everyone to not get into a situation where you need any kind of healthcare intervention. The first important thing where everyone wants is that the person is able to manage himself. That has come to very strongly during these during the pandemic. We would need people to be able to manage themselves well. Either isolate, not use healthcare, which is very scarce, or requires a lot of high-end intervention, which the person may not require. That's one part which I think has got learned very strongly with treatment. The other one important thing is that resources are very, very finite in terms of whether it's even if you can run out of, even if you're insured, you could run out of insurance resources. So some of that may devolve back on you. There is finite amount of insurance. You may have a certain limit on some insured and various other things and all that. So for you to plan well, and it's a long sort of journey from as we call it, the cradle to grave, and you need to be prepared for it. There, the element of data, and using it to be able to understand financial risk arising out of healthcare, healthcare risk is very, very important. And what products and what, how do you take care of it? What part should you manage yourself? What part should be managed by the ecosystem? Let's say you are, in a stage where you are employed, so a lot of help comes from the employer, but at a stage where you are getting retired, you would need a different way of managing your healthcare risk, and the burden of healthcare, the risks which you face in old age is very different from the risk which you face, when you're a young adult. All that entire, spectrum, or the entire, kind of chain, has to be monitored very strongly. And last but not the least, I think what we realized so far is that, you have to, we have to use the whole power of nudges, as I call it. The insurance system, the various, because, it's very important that, the person there, he doesn't understand, whatever data you play back to him, he may understand it very, very, distantly. The real players, the healthcare providers, the insurers, the government, various other bodies which are interested in healthcare, understand health risk. We get that huge amount of data. We understand what's the cost of treatment. Nobody knows what a huge trauma, accident, the thing, or somebody falling from a, let's say, we know because we handle it, we understand the cost of all of that coming back to us. So, it is important for us to be able to nudge people to be able to, be not only take care of his own health, which is very important, but seek intervention at a strategic time, seek products, whatever products he needs to at a time where he's, as they say, in peacetime rather than wartime. And this the pandemic has taught us, even if it's a simple thing that you go late to a hospital, you're compromised in the kind of treatment you would need in COVID. You just, we've seen cases where people have dilly-dallied or not, got them. I'm not talking now, I'm talking even earlier, when it was not so bad, that people just, having seen the first wave, just dilly-dallied, and there were cases of late presentation. So that's where, so nudging is very, very important. Ability for players to get the data or get some sense and then tell them, now it's time, please go and get yourself admitted. A lot of people do not understand risk at all. And, and the timing is very, very important in the whole healthcare journey. So these are two essential elements which have come out of it, because the consequences are huge. Lives and, livelihood are so healthcare, and we used to make these kind of things, that, single healthcare episode would put back a family, below poverty line. But here we are talking about serious, entire families being gutted and all of that. So that's where I think it's very good.
That's a very valid perspective. And I think given the treasure trove of great data that the health insurance industry is sitting on, perhaps you have one of the most powerful tools, like you said, to nudge or, impact behavior at the patient level, whether it is for preventive wellness or, even to take action at the right time. And I'll come back to you on that. Before that, I'll come to Prashant, my friend, who's one of the top 10 data scientists of India. And Prashant, you're obviously doing some cutting edge work. And I think for the benefit of all the viewers and on the panel, tell us very briefly about what does Cure.ai do and how y'all are using data to impact health.
Sure. Thank you, Kumar, for inviting me on this panel, and it's a pleasure to be part of this very, I think powerful group of people and very knowledgeable group of people here. So I'll talk about Cure.ai. We have been around for about 5 years. We use AI to interpret radiology images. So think about it this way, that if you have an X-ray that needs to be read, you send it to our API, we can actually identify all the abnormalities on that X-ray, and we can interpret that X-ray, create an automated report. So rather than having a radiologist who's reading that report, we are able to do that automatically using AI. And we can do that for X-rays, we can do that for CT scans, we can do that for MRIs. And typically there are multiple ways we provide that output. One is that it is not intended to be provided to a human being, to a patient, right? So we are intending it to be provided to a doctor or a radiologist, where they are using this AI tool to be able to report faster, to be able to report better, and to improve their productivity. So there are places like Philippines where we're able to reduce the time to read for a scan, for an X-ray scan, from about 5 weeks to a single minute, because there is no radiologist available. So we can actually just, take away that radiologist, we can interpret that scan, provide that report to a general practitioner. So we are doing that in many parts of the world. For trauma and stroke cases, imagine somebody who's coming in with trauma or stroke, and you are looking at reading that scan as soon as possible. And a lot of times the radiologist may not be available on call. They might take about an hour, 2 hours to read that, which is life and death for a patient who's been in a trauma or who's got stroke. And we are able to read that scan within a minute again, and we can alert the radiologist or the physician, emergency physician, on their phone as a Telegram message or a WhatsApp message. So we are able to do all of that very, sort of improving the quality of reporting, improving the speed of reporting. And data comes into play here because, again, these technologies take especially AI requires a huge amount of data to be accurate, right? So if you are looking at AI, building AI, you are talking about millions of scans that come together to be able to train an algorithm. So in some ways, AI is not as smart as human beings, right? A human being can look at a kid, can look at a cat or 3 or 4 cats and figure out what a cat is, right? But for AI algorithm to figure out what a cat is, it probably needs some 500,000 images of cats and other objects. So then it figures out what a cat is, right? So in some ways, AI, I mean, overall from the amount of data that it takes to train is a lot more. And for us, I mean, we have gotten about 3.5 million scans, X-ray scans. Just look at 3.5 million X-rays and their corresponding reports to interpret, to build the X-ray AI. And you can imagine that is amount of data that a human radiologist probably will take about 100 years to go through, or maybe even more, right? So and if they're working throughout the day, I mean, that's sort of the kind of volume that we need to train the algorithm. And similarly for head CT scans also, we have trained our head CT scan algorithm on about 500,000 scans, which is easily each scan has got 100 images. Basically, it's slices of the brain. So you've got 100 images per scan, and you've got 500,000 scans. So it is about, again, 50 million images that have gone into training the algorithm. So data becomes key, because I mean, you are able to then take that data and train the algorithm. And how it is trained is, you typically, what you do is, one way to look at that is, I mean, think about how you're training an algorithm, AI algorithm, to understand everyday images, right? Let's say cats and dogs and all of that. You can label one by one. So you have a million images. You go into each image and label, saying this is a cat, this is a dog, this is a ship, this is an aeroplane, and so on. Now, Amazon does a lot of that. They have these mechanical turks where you can go in and you get paid for doing that. And that can be crowdsourced, because you have lots of people. Everybody can label that. Any kid more than 5 years old can probably do that labeling, right? For us, I mean, that is not feasible, because we cannot get anybody to label those X-rays or CT scans. So what we have to actually do is, either we get a radiologist to label them, but then labeling is limited. I mean, they can label maybe 100 images a day. So you have to spend, I mean, years to get it labeled, for 10, 15 years across a large group of radiologists to label that. So what we have actually done is that you have the X-ray and you have the corresponding report, the radiologist report. So we built natural language processing algorithms on the report, where you can now figure out what the abnormalities are. I mean, whether it's a normal or abnormal X-ray, and if it's abnormal, what are the abnormalities on that X-ray? And then we provide that as input to the machine learning algorithm, to the deep learning algorithm, where the algorithm is not able to figure out that, now able to figure out that this is the abnormality on this particular scan, and then it learns from there. So that way you can actually give it a lot of data, and it can automatically learn from the data that you have provided it. So that is where Cure is. And of course, I mean, these are medical devices. So these require FDA certification to sell in the US. These require CE certification to sell in Europe. And every country has got some level of regulatory clearance required to sell these solutions. So we have gone through those. We are FDA approved. We are CE certified. We are selling in about 50 to 60 countries right now across the world. And today we are live in about 40 countries already. So
fantastic.
yeah.
And what you're saying is so true, because the example that you gave about Philippines, where the absence of a radiologist was filled in with data-driven technology, right? And this is taking me back to both what Mr. Datta and Mr. Chakrabarti said. Mr. Chakrabarti, you mentioned about changes in the delivery of healthcare. And do you see the nature of the hospital really changing? I mean, let's say at some point in time, do we envision a future where the hospital will only exist for, let's say, surgeries or complicated surgeries, and everything else can be distributed? I'm not saying that future is happening tomorrow, but maybe at some distant level.
So good question. In fact, I'm not sure whether in my lifetime I can see that in India, because if you, as you mentioned during introduction, for last 20 years I'm in the healthcare sector, and I have seen the transition. Now this telemedicine, teleconsultation is not something new what we have experienced. It
True.
was there, but it took a lot of time for people to adapt, and now because the situation was such, there was no other option and they have gone for it. Now, coming back to your question, I'm sure that some hospitals will be early adapters to this. They are likely to get into some of these modes. But typically, I will prefer to still have doctors, patient, and most importantly, for which we are known, that so-called the doctor's touch. Doctor comes and they check the pulse, and if that doesn't happen, everything happens in a virtual mode and everybody remains away. I don't think that kind of doctor-patient relationship, that kind of the mental satisfaction of
Right.
the patient can happen. However, in terms of diagnostic part, the way it has been explained, artificial intelligence, some of these, point of care testing in some places, the diagnosis, not only in imaging, but whether it is ophthalmology or some other specialties, the reading of these diagnostic reports, its interpretation, and on the basis of that, sometimes the advices are coming out. And I can tell you that in our rural health program, we are using some of these very frequently, because there is a scarcity of doctors or the qualified person to do that. And when you are using that there, I don't find there is any harm slowly and steadily to adopt that in the hospital which are in metro cities. And I'm sure that the age what you have explained at the beginning of the question, that is not going to happen, that will happen, but probably it will take some more time to come when we'll be getting into that mode. But it will take some more time for our patients, our community to get into the adopted to that culture, and hospitals to reach that level of, I should say, technology savvy, or adaptation mode.
So clearly, you see that as a possibility, but of course, the timing of when that happens, when technology sort of overtakes medicine to a certain extent, when that will happen. Mr. Datta, final question to you. You mentioned about nudges, and I'm a firm believer in that. And I think with the data that the industry has, we all know that preventive medicine is one of the things that the industry is also looking toward to financially lower the burden on the industry as a whole, and also for absolutely good patient care. What do you think the industry can do, especially insurance, given the kind of data and reach you have, in nudging people for better mental health, better behavior, better practices for themselves?
So, the nudges, the way I look at it is, one is to, if you are healthy, to keep yourself healthy. It's very, very important to maintain, so there's a whole lot of, I'm not getting into wellness and all of that, but just to be able to get yourself tested and be, able to maintain yourself in a manner with both mental and physical, kind of well-being. But if you just take that apart, there will be a lot of people who will be subject to diseases, actually. It's part of the morbidity we are, the condition which we are born with. So the issue here is early detection and, early treatment, and so, I think, Prashant talked about, good, detection, fast detection and getting it right the first time. And that to me is a huge, huge issue, because again, Chakrabarti talked about a lot of places where detection is an issue.
Sure.
Because of the, this to me is a very, very important issue of the preventive stuff. So early detection, where you can actually do a lot of interventions, whether, of the curative kind or of the, the kind where you are able to just tell the patient to take an alternate way of lifestyle or something, can move him along the space where he uses precious healthcare resources sparingly. He doesn't use it for the chronic stuff, too much, so that we are, we like to do the stuff which is very, very important, whether it's critical infections, critical traumas, or various other interventions which healthcare is designed to provide. So, and also, of course, while you are also looking at preventive, you need to use a lot of complementary, approaches, medicines, or very other approaches to well-being, which can complement that entire thing. And this is possible if you have, you are able to use data to be able to reach out and understand the person's thing. One is generically, I know you've reached 45, you need to get yourself tested. You need to go through these tests, because the other one is through data of the very, very, I think going ahead on genetics and various other things.
Sure. No, some great points. Unfortunately, we've run out of time. I think the next panelists are just about logging in. But thank you, gentlemen, all three of you, some fantastic views. And if I was to just tie it up in 10 seconds, I would say, on one hand, we are seeing great data, playing a role in terms of diagnostics, great data playing a role in terms of nudge and, helping people change their behavior, and data playing a role in healthcare delivery and point of care. And we have all the three of you playing important roles in that. Thank you so much for your valuable time and some great comments. Thanks.
Thank you.
Thank you very much. Thank you, IMC. Thank you, Aaron.